If you've ever taken Accutane or you use retinol creams and you now struggle with either dry or irritated eyes, then this video is for you.
Oh, you shouldn't have.
Before we begin, I want to make it crystal clear that this is not a scare video and is definitely not a stop using retinol video. This is simply about understanding what the risks are, some patterns I see in clinic, and making sure that we use products safely without unintentionally affecting our eyes. Okay, let's dive in. Hey everyone, I'm Dr. C, a double board certified optometrist and the owner of Eye Drop Shop. Today we're diving into the world of retinoids. But before we start, please make sure to like, subscribe, and ring the bell so you don't miss any future videos. This is such an important conversation to have because retinoids are literally everywhere right now.
So hot right now.
If you scroll on TikTok, Instagram, YouTube, you'll see tretinoin routines, retinol transformations, and Accutane before and afters constantly. And listen, it's because these retinoids work.
Told you, told you, told you.
They're super effective for your skin, for acne, for anti-aging.
I use it all the time.
And as an optometrist who treats dry eye disease every single day, I'm definitely not anti-retinoid. But the thing is, what I don't see talked about enough is how these medications, especially Accutane and sometimes topical retinoids, can really affect the eyes.
You know, it's kind of a secret.
Again, I want to be very clear about something right off the start. Not everyone who took Accutane will develop dry eye. Not everyone who uses retinol will have dry eye symptoms. I have many patients who took Accutane years ago and have completely healthy eyes and meibomian glands. So this is not a 1 + 1 = 2 situation.
It's not that simple.
What we're talking about today is risk, not certainty. Let's start at the beginning. What are retinoids? Retinoids are compounds derived from vitamin A. And the three main ones that people are familiar with are 1, retinol, which is an over-the-counter topical, 2, tretinoin, which is a prescription topical, and 3, isotretinoin, which is commonly known as Accutane, and this is an oral medication. These medications work by increasing cell turnover and decreasing oil production, which is exactly why they're so effective for acne and any kind of skin concern. Now, here's the part that often gets missed. Your eyelids contain meibomian glands. These tiny little glands produce oil and it's secreted on the surface of the eye to prevent your tears from evaporating. Here's the key point though. Meibomian glands are also sebaceous glands. These are the type of glands that retinoids will act on to decrease the production of oil. So that's why when you use these on your face, your acne will get better because it will shrink the oil in the pores, but it's also doing this in the little glands in your eyelid.
That makes sense.
Most of the research linking retinoids and dry eye focus on the oral component, the one that's called isotretinoin or commonly known as Accutane. These studies showed association with reduced tear production, a shorter tear breakup time, meibomian gland changes, and increased dry eye symptoms.
I was not aware of that.
Now in clinic, what I often see is a patient comes in with, their usual burning, irritation, contact lens intolerance, whatever it may be. And somewhere in their case history, they'll casually say, oh yes, I took Accutane a few years ago. Now, that doesn't mean Accutane caused their dry eye. I'm going to say it a million times, but it is a relevant piece of the puzzle. And that's why I want to talk about it today, because every time this conversation comes up, my patients will say, oh my God, I had no idea. And they're right. It isn't talked about a lot. And that is why I'm here today, just to bring this up so that everybody is aware that there is a little risk. Now let's talk about topical retinoids because this is where small changes can actually make a huge difference. So retinol and tretinoin can migrate on the skin.
I travel a lot.
And you don't need to apply it very close to the eye for them to work. So my general recommendation on it is this. You want to apply retinoids starting at the orbital bone, so the part that's actually hard that you're touching, okay? Really, really away from the actual eye. And definitely not in the inner corners or on the upper movable eyelid or very close to the lash line. Because this will significantly reduce the risk of having any kind of side effect if you're staying away from the eye itself. By the way, this could be with retinol or any other makeup or skincare products. So why don't you comment below and let me know if you want me to make an entire video about either skincare or makeup, how it affects the eye, maybe safe alternatives. I think that could be a good idea. Let me know in the comments below because I read all of them. So here's how to use retinoids more safely, okay? We want to start low and slow. We want to use the lowest effective concentration and just stay away from your eye as much as you can, moisturize, and really just take it very gently. Anytime we put anything near our eyes, we want to be really careful. And if you're watching this and you have taken Accutane in the past, well then just be a little bit more proactive about your eye care before it becomes any kind of issue. And if there is something and you're noticing a change, then this is something you should bring up with your eye doctor. The most important part is my conversation with the patient. Everything you say is so additive to the eye exam. A patient comes to mind when I'm thinking of this exactly because she came to see me and she had filled out all the, pre-work and the paperwork that we ask you to fill out. And I remember looking at her meibomian glands, which in this case were shortened. They were not as long and full of oil as they should have been. And when I looked at her, I also saw that there were a few acne scars. So once she was done speaking, I sort of looked at her and I said, hey, did you ever have acne when you were younger, maybe a teen? And she goes, yeah. And I said, did you take any kind of medication for it to sort of dry up the acne? Anything called Accutane? And she says, yes, I took it from when I was 17 to 18 years old. And she goes, how did you know that?
Mystery solved.
I never thought this would have an impact on my eye. Most people don't because it just wasn't spoken about. And I think to this day it isn't spoken about. But now that we know better, we do better. That's kind of my philosophy on everything. I think for this patient, it was really a light bulb moment.
Everything makes sense.
It's very settling to know where your dry eye begins. And then it also helped us guide the treatment so that we can work on those little oil glands and try and kind of revive them and get them to do the best work that they can. So if you've taken Accutane or you've used retinol or tretinoin and you're noticing some eye symptoms, then definitely bring it up with your eye doctor. Also leave a comment below. I'd love to read about it and start a conversation. So you don't have to choose between good skincare and healthy eyes. This isn't about stopping treatments that work. It's about being informed, being mindful, and protecting your ocular surface while still doing the things that make you feel confident and great. And if you want more videos where we connect skincare, eye health, and real life, then make sure to subscribe and like this video and share it with someone who you think needs it. So take care of your eye health, and I'll see you in the next one.